Hey, it's Nurse Des, and today I'm going to break down fluid imbalance. Fluid imbalance might sound complicated, but once you understand the basics of hypervolemia and hypovolemia, it's much easier to tackle. It's a concept you would need to master in clinical practice, and understanding these two, hypervolemia and hypovolemia, it's crucial. Nurses must be able to recognize these subtle changes in fluid balances in patients. So timely assessment and interventions prevent complication and save lives. First, let's talk about hypervolemia or excessive fluid volume. This happens when a body retains too much fluid, usually in the intravascular compartment. Conditions like heart failure, kidney failure, cirrhosis, and even pregnancies can put patients at risk. Some key signs to watch for include pitting edema, which is where the skin stays indented after pressing, ascites, which is fluid buildup in the abdomen, dyspnea, shortness of breath, and crackles, which is fluid in the lungs. Treatment often includes restricting sodium and fluid and using diuretics to eliminate the excessive fluid. On the flip side, hypovolemia or deficit fluid volume occurs when a body loses more fluid than it takes in. This can happen from dehydration or excessive fluid loss due to causes like diarrhea, vomiting, excessive sweating, or poor oral intake. Some common symptoms of dehydration are thirst, dry mouth, dry skin, dark urine, fatigue, dizziness, elevated heart rate, and low blood pressure. And in severe cases, it can even cause changes in a patient's mental status. And in severe cases where the body cannot maintain adequate blood pressure and it's a lack of perfusion to vital organs, the patient could go into hypovolemic shock. So our patients who are vulnerable to dehydration are older adults and infants. And also patients with chronic conditions like diabetes and kidney disease. And people on diuretics or those who work in hot climates outdoors are also prone to dehydration. So understanding fluid imbalance is key in clinical practice because recognizing these signs of both excess and deficit fluid volume can make the difference in patient care. So keep these tips in mind and you'll be ready to manage fluid imbalance like a pro. If you found this video helpful, don't forget to follow for more helpful tips. Thank you for watching, and until next time.